And so I'm also seeing the potential for so many situations where patients don't have that luxury.
Yeah.
And they might be able to actually get more, at least solve some basic problems or get basic information.
Sure. Especially around analysis of things like social determinants of health data.
Right.
Hey,
Right.
we've analyzed some basic stuff. We know mortality rates. I mean, you wouldn't be spewing this back to people, but based on what you've shared,
Right.
we would recommend changing these lifestyle habits.
Yeah,
Simple.
exactly.
You know?
Or I have a cough and a fever. Do I need to go to the doctor or not? Well,
Yeah.
the AI can ask you a few more leading questions that would be the same thing
A doc
any
would ask.
primary care provider would ask, and it may turn out, no, wait a couple of days, see if it gets better. If this and that happens, then yes, you should go to the emergency room. So,
Yeah.
that can reassure people. It can give a lot of good advice.
Yeah, I like that. And with the patients and the doctors together, I know that currently today I can go in and record my doctor's appointment because I can't keep handwritten notes. But as long as I ask the doc, I'm going to record everything that's being said. Plus, the doctors are doing a public service.
Right.
Now, one of the dire needs of the major AI firms out there, especially in the medical space, is to actually capture the conversation between doctor and patient in the hospital room. Now, the only technology in the world that allows that to occur is our technology, TARTLE.
Mm-hmm.
And so patients can go in and share their recordings, whether it be audio or audio and video, and they can give that back to the model training sets and say, here is the outcome inside of a very private event, but totally consented to by all the parties, sharing this information. It's fantastic, rich information that's very helpful.
Well, thanks for having me. This has been a fun conversation.
Yeah. Is there anything I missed? Anything you want to close on?
No, I wanted to make sure to get that part in about the shift from having the principles apply only to patients to now having them apply to clinicians.
Yeah, it's a nice balance.
That's a nice balance. And, I would just say in this world that we're so polarized and so much divisiveness that if you go into any hospital in Santa Fe here, there's a sign at the front desk that is the code of conduct for patients.
Yeah.
That, treat people respectfully, treat your nurse with dignity. I mean, we've always trained the nurses to treat the patients with dignity, but we're now at a place where there's so much anger and so much polarization. So I'm hoping that thinking about the principles this way can help to bridge that divide too.
I think that's fantastic.